Hello, good morning to everyone. I am Elango Nursing Principal from KIPV Government Medical College, Trichy. I am happy to take about this class. This cyber class will be more helpful for the nursing students, those who study diploma nursing, BS nursing, and post BSc nursing. This slide informations and content will be short and sweet and more effective, is content oriented, so you can listen and get benefited. This is my sixth video that I am going to transform to you, and if you want further videos you can contact me through my email, that is relango209@gmail.com. My cell number is 8838878726. Let's go to the topic, that is safe and effective environment. So providing safe and effective environment within the hospital is the responsibility of the hospital administration and staff nurses in the ward. The first and foremost is fire safety in the environmental safety, which shows RACE, that is race, rescue the person, alarm the environment, confine the situation, and extinguish the fire. These four things are most important. In the electrical safety, all the switchboards and switches should be fully covered, and there should not be any leakage or short circuit. And splitter will be most useful. Radiation safety, according to the control board, you can use the radiation by controlled manner. The unauthorized person cannot enter inside. This should be constricted. The area should be constricted according to the protocol. If you want to provide a safe environment for the patient and for the public in the hospital, you should dispose the waste matters in such a way to dispose it. Patient fall within the ward is more common, but it should not be happen. The nurses are the responsible person if the patient fell down. So you need to assess the patient, assign the client room near nurse's station, orient the physical surroundings. As a nurse, you should give orientation to the patient, the things which are surrounding the wards. You can use the call bell, you can provide the call bell to the patient. Better you lock all the beds, wheelchair and stretchers. If the patient is fully unconscious, then you can free up the bed. Adequate lightings is most important. Decrease the bathroom hazards and handling techniques. Restraints. This restraints depends upon the hospital policy that you can use it. This depends upon the patient's condition, patient's age, violency of the patient, the level of the consciousness of the patient. It's all varies according to the hospital policy. You can use the different types of restraints. In the poison care, the nurses are the fully responsible for a person in this ward. They should keep under lock and key. Remove obvious matters if you see near the bed or in your surrounding. Call poison control center if anything goes wrong. Not to induce vomiting in unconscious patient, because it may choke the patient and that may leads to many serious problems for the patient if the patient takes poison unexpectedly. Vomit is induced and save it in a conscious patient. If any patient unexpectedly taking poison, that you can instruct them to vomit the things and save the vomit and send it to the lab, and you can save the patient. Nosocomial infection is the hospital acquired infection. Hospital acquired infection, this is not present at the time of admission. This is transmitted through the healthcare personnel to the patient, and from the patient to another patient, and from the patient to the hospital personnels. More common nosocomial infection is urinary tract infection, ventilator associated pneumonia, surgical site infections are common. This nosocomial infection by the bacteria, virus and fungi. The UTI infection is mostly by the E. coli. Some standard precautions everyone should take when you do the duty in your ward. The standard precaution says, which includes proper hand wash, gowning, wearing mask, gloving and particular dress, goggles, overshoes and so on. Indicators shows the admission area for the serious case. These are all the way to protect yourself at the time of attending the case. The respiratory spread of infection within the hospital is more common, so protective devices should be properly used by the hospital personnel. The spread is 20 feet distance if the patient cough. The second picture is about N95 mask. Protect yourself. Thank you so much for your listening. This biological weapons for the next class. Thank you.